We are talking healthcare and insurance in the next 30 minutes. First up, a big step forward for healthcare in North Carolina this month. More than 600,000 people can now get Medicaid coverage through the recent expansion. It took years for lawmakers to reach this deal and push it through. WFMY News 2's Amber Lake talked with people that are really thankful for this coverage.
Phones ringing off the hook.
As soon as word got out, we started receiving phone calls.
People are extremely happy.
From people eager for health care coverage.
I think that is a good thing.
I feel like it's definitely going to be a positive move going forward.
As of December 1st, anyone between the ages of 19 and 64 who make less than $20,120 in a single adult household or less than $34,000 for a family of 3 are now able to get the care they need.
Because there's a lot of struggling people that's not making a lot of money, and healthcare is serious because you need it. So if you're sick, you have to go and get taken care of.
Taken care of. That means access to primary and preventative care, mental health and substance abuse treatment, emergency care, and getting prescriptions.
We have community members that haven't had access to health care in many years, and so now they're going to have that, and so they're very excited about that.
College students tend to not go to the doctor because they may not have any health insurance coverage.
One college student is taking advantage of the expansion. Soon, Sydney Smith will be able to make a dentist appointment, something she's been putting off due to lack of coverage.
It's a domino effect. It'll affect when you're able to get seen, if you're able to get seen at all, where you're able to go, because there are some doctor's offices that only take, health insurance from your job. So being able to be on Medicaid and finding those facilities that'll, have you even based on this insurance is always a good thing.
So this is what we're going to do today. We're going to get your Medicaid and Affordable Care Act questions answered by a statewide group of healthcare experts. Sammy Leach with the North Carolina Navigator Consortium is here with us in studio to talk about all the enrollment and how the folks that you see right here on this Zoom can help you. All right, in the meantime, what I want you to do, I want you to pay attention to the number that's at the corner of your screen. That's 855-733-3711. You can call and talk to one of the folks that's on this Zoom call until about 6:30 tonight. All right, so all the folks that we see behind us, they're part of this North Carolina Navigator Consortium. What is it?
Well, the Navigator Consortium is a federally funded organization. We don't take money from consumers and we don't take money from insurance companies. Our sole goal is to make sure that everyone has the information that they need to make the best choice possible in terms of getting health care. So some people don't know whether they apply for Medicaid under the expansion. Some people don't know what options they can choose from on healthcare.gov. So our goal is to give you all the information that you need with the information that you give us. See if you qualify for any subsidies or anything like that, and just help you sign up for the best healthcare.
Okay, and so we want to make it really clear. Like you said, this is a free service.
Yes, absolutely.
They're not going to pressure you to go one way or the other way. What they are going to do is they're going to ask you questions about what you need in healthcare.
Yeah. And ultimately, the choice is yours. We're making sure that you have all the options available, like every option that you have to make your healthcare as affordable as possible. But it's up to you to choose what plan is best for yourself and your family.
All right, and we're talking Medicaid, and we're also talking about ACA enrollment. So let's first just tackle the Medicaid expansion because this is something that's new.
Yeah, absolutely. I mean, Medicaid is full comprehensive coverage. It'll cover, your hospital stays, your regular checkups, dental, vision, maternity care, and so much more. Mental health, and it's really reasonable copays, around $4. So it's great. And even if you weren't eligible in the past, check now and you can be eligible now. And we urge people to give us a call or talk to one of our navigators to find out if you're eligible.
Right, and they are going to ask you what is your income for your family, how many people are in your home,
up to a family
of
of 4, 41,400 up to a family of 4, you could be eligible if you're between 19 and 64. So if you were denied in the past, let us check your eligibility now.
Okay, that is Medicaid. Now we're talking about open enrollment for ACA.
Yes.
And so for this marketplace, the deadline is kind of looming.
Yes, the deadline to be for your coverage to start January 1st is December 15th. So check your plan options and sign up for a plan by December 15th, and you will be covered on January 1st. Now, because of the MLK holiday falls on the 15th,
Yeah.
they have extended it one day to the 16th.
Okay.
That's when open enrollment closes. If you do register by the 16th, your coverage will start February 1st.
Yeah, in January.
Yes.
Okay, got it. All right, but the thing is, you don't want to wait until the December
No.
15th deadline, which is why these folks
Yeah.
are here.
Yeah, absolutely. That's why they're here. They want to take your calls and answer your questions, set you up for a free appointment to talk to them, bring all the information you have in terms of your health history and any type of income information, and we'll find the best plans for you and give you those options so that you can choose them.
Right. And so if you have already been part of like the ACA plans before, and you're like, I'm just going to let it just re-enroll, it doesn't make a difference. Really, they should.
They should. They absolutely should. We have 9 insurers across North Carolina, about 5 per county. So, you know, it creates competition, which could lower your premium. Find subsidies because 80% of people can get a plan for $10 or less. And 9 out of 10 North Carolinians actually qualify for some type of subsidy to make their premiums lower. So definitely give us a call and we can see what options are available for you.
Yeah, and maybe your income has changed, maybe your
Yeah.
doctors have changed, maybe
Absolutely.
your healthcare has changed,
Yeah.
maybe your plan has changed and you don't even know it.
Yeah, yeah.
Okay, all right, so what we're going to do is we're going to continue to have this healthcare conversation. The number is at the bottom, 855-733-3711. Make sure you call and talk one-on-one with one of these experts.